What are some signs and symptoms of hyperparathyroidism? First, the effect of hyperparathyroidism on the digestive system. It causes loss of appetite, nausea, vomiting, and constipation. So in digestive system, it is nausea, vomiting, constipation, and loss of appetite. In the nervous system, the effects are fatigue, depression, and confusion. If we discuss about the muscular system, then in the muscular system, it causes weakness of the muscle, aches and pains in the joints and bone. In the urinary system, it causes formation of the kidney stones, increased thirst, and urination. So these are the signs and symptoms of the patient who has hyperparathyroidism. So all these are the systems which are mainly affected by hyperparathyroidism, and because hyperparathyroidism is associated with the increase in the level of calcium in the blood and decreased level of phosphorus. And this increased level of calcium, make sure you should keep in mind that this increase in the level of calcium is because of increased reabsorption from the kidneys and decreased excretion from the kidneys, and the other mechanism is by increased reabsorption of the bone or calcium from the bones. And when increased reabsorption of the calcium from the bones occur, then naturally the bones become very weak and fragile. That causes the patient to become very fatigued, depressed, and then we have also aches and pains in the body because this increase in the level of the calcium is due to reabsorption of calcium from the bones.